Hello, and welcome to the American Society of Regional Anesthesia and Pain podcast, ASRA Wrap. I'm your host today, Raj Gupta, and I'm coming to you from Nashville, Tennessee. And I have a fantastic program for you today. We're going to be talking about our upcoming fall meeting in Orlando, Florida, and I have the chair of the meeting with me today to talk about that. But before we get to that, I do want to share a couple of announcements about what's coming up with ASRA Pain Medicine, some of the really important events and opportunities coming up in the next few months before the fall meeting. So you have some opportunities to interact with this community even before we get to the big meeting in the fall. So let me show you a couple of these things here. So first off, if you missed it last week, I talked, or I think it's been 2 weeks now, I talked to Vivian Ip and some of the other program chairs for the environmental sustainability and green anesthesia webinar that's coming up with ASRA Pain Medicine. That is this weekend. So I want you to make sure you go to the ASRA.com website and you can register for this. This is a full day virtual webinar and you do get CME credit for this. Plus, if you register, you'll have access to the material afterwards. So if you can't watch all of it live, you can watch it after the fact as well. So I encourage you to go to that. I think you're going to learn a lot about what you can do in your own practice to improve green and sustainable anesthesia delivery. Second thing is we have a Hot Topics webinar. So these are a series of webinars designed for primarily trainees, but other people can join as well. And these are small topics that are designed to spur conversation and really educate our audience. This one coming up soon, October 11th, is on acute pain management of the complex chronic pain patient. This is a great lead in to the fall meeting because these issues of acute on chronic pain come up all the time. We have a fantastic panel and I think a really good conversation. These are free to attend if you are an ASRA Pain Medicine member. So if you have your membership, or if you don't, make sure you get it. But if you have your membership, you can register for these, and these are free. This is under the upcoming events at ASRA.com. Next up, we have our ultrasound guided regional anesthesia cadaver course. Now this course has been going on for years. It is a fine-tuned experience. It is a weekend course in Chicago. I encourage you to register for this. Top-notch, world-class faculty, experienced teaching regional anesthesia, and this is a hands-on experience like you can't get at most other workshops. So go register November 5th through the 6th. It's coming up really soon, and I don't know how many slots are open, so make sure you go to the website and register for that. And then last but not least is right around the corner is our ASRA Fall Pain Meeting. And this is going to be in Orlando, Florida, November 17th through the 19th. And before I introduce my guests, I want to point out one thing, which is the early bird registration is October 6th. That is next week. So make sure you go and register, save some money, register, and you'll be right on track to attend the meeting with us. So I'm going to repeat that later. So just don't forget, October 6th, next week. Make sure you don't miss it. So that's a great lead in to our guest, Amy Pearson. Hey, Amy, how are you?
Hi, everyone. Very good. How are you?
Now, let me do my formal introduction for Amy here. So Amy is a board-certified anesthesiologist and interventional pain physician at Aurora Advocate Health in Milwaukee, Minnesota. She completed her anesthesiology residency and pain fellowship at the Mayo Clinic in Rochester, Minnesota. She's published over 30 articles on topics such as interventional cancer pain management, peripheral nerve and spinal cord stimulation, interventional pelvic pain management, and integrative medicine. She's presented her research nationally and internationally and is really excited to be chairing this fall meeting in Orlando, Florida. Amy, thanks so much for joining me. I'm really excited to talk about this meeting.
Me too. I hope everybody can make it. And like Raj said, that October 6th deadline is going to be really key because you really want to stay, if you can, at the meeting hotel. It's going to be really fun.
Yeah, I mean, the best experience for any of these meetings is to stay with the crowd and getting to connect with people both before the meeting in the early morning if you're an early riser, but especially after the meeting, in between meetings. You don't want to be running back and forth to another hotel. You want to be where all the action is. So make sure you register early and then make sure you sign up for your hotel room so you don't miss those spots. Now, Amy, I want to dig into the meeting a little bit. Now, most people don't know this. For those of us who've had the privilege of chairing one of these meetings, this is a multi-year process. You've been thinking about this meeting, working on this meeting, eating, sleeping this meeting for many years now. This is not just like a 6-month planning effort. This is something that was your brainchild maybe 2.5, 3 years ago.
Yes, you're right. And it may have even predated the pandemic. So it was interesting to have a vision in my mind of a live meeting and then have that vision go to a meeting that was maybe going to be all virtual or non-existent
Yeah.
back to a full in-person meeting. So um, props to all of the chairs before me that I got to learn from.
Yeah, so let's talk about that before we get any further, because people may have questions about that. As far as we know, things are open in Florida. Things are open for people coming from outside the country to come to the United States, unless their country has specific exceptions. We highly encourage people, if they can be vaccinated, to be vaccinated. And then obviously, if you're sick, don't come and get everybody else sick. But this is going to be a live in-person meeting. And, with the full benefits of having those interactions with your colleagues and all the experts in the field.
Absolutely. So yeah, I'm really excited about that part. And I do think that, the whole focus of the meeting and the theme is making connections. So that it was already part of my brainchild before I even before the pandemic even happened, and it became even more of it felt even more right to choose that once the pandemic hit. And now that things are over, now that we're kind of getting back into a rhythm, now is the time really to start making renewing old connections and making new connections, because we were without for 2 years. So in a way, like pain medicine, has been advancing as a specialty, and there have been gaps, and now it's time to make those connections again. And I have to say, like, it may feel awkward, and it may take some challenging of ourselves to really put ourselves out there in a new meeting, and meeting other people like we were used to. And I really hope that we've made some programming that makes it easier for all of us to be in places where we can interact with each other, where it feels natural, even though we're all wearing masks, even though we all have, our own thoughts and feelings about, how things have gone in the last 2 years. So, yeah.
I think that what we've realized is that although I'm a big proponent of these online interactions, and they're a great stopgap in between the times that we have a chance to interact with each other in person, but I don't think there's any real substitute for that personal, what I call the hallway communications, the opportunities, the impromptu, serendipitous opportunities that come up with just interacting with people in the hallway. So being at the meeting is where you get those kinds of opportunities. Zoom calls and these webinars are fantastic for information exchange, but you miss that component of it, that special part that builds those relationships down the road. And I think we're going to have one more guest here join us in just a second, and I'll do his introduction as well. We'll give him a second to get connected fully, and then I'll have him join. So, we were talking about making connections, and I think that we're going to return to that theme multiple times in this conversation. And I know you've been very conscientious about the program and how it's presented. One of the things that was really stuck out to me is these medicine tracks, these pain medicine tracks. These are an opportunity to kind of, connect one concept across multiple lectures and workshops and sessions, so that if you're focused in that area, then those things go together appropriately. Talk to me a little bit about these pain medicine tracks and how that fits.
Yes, this is something I'm very excited about. So I'll give you an example. So the first day on Thursday, our tracks are head and neck and peripheral nerve and joint. We tried to use tracks that were a little bit somewhat different from each other so that we could have folks kind of follow through the same track and hopefully not miss too many sessions that they were really interested in. So this is how it might go for somebody. Let's say you really want to start a headache practice, but have no idea how to start doing that. Well, we've added refresher courses and workshops and PBLDs that all have some kind of connection to head and neck on Thursday. So you could go from a plenary session to a workshop to a refresher course, all about head and neck for the entire day. And the advantage to that is that you really get some good interactions with some of our top faculty. I'm always amazed by the just knowledge base of the people that we have as faculty. So you could follow through, do nothing but head and neck, and really get to know the faculty, really get to know the colleagues that are with you in these sessions too. And it's very likely that you will find that if you are an academic physician, you'll find someone in private practice who is also going along that track, who can give you pointers and help you understand maybe something about how you run a successful practice financially. And maybe you can give them pointers on how to get a hold of the latest research or be a part of the research design.
Yeah, we've had these conversations a lot in that private practice academic partnerships.
Mm-hmm.
You and I have had those conversations many times ourselves, is that often these meetings are centered around academic interested topics, but really the private practitioners are looking for good information to learn from, but also have a lot to offer back to the conversation. And we think that the only information that's useful is coming from these big academic centers, but oftentimes the private practitioners have been doing these things, maybe not writing them up, not publishing them, but have been doing them in practice years ahead of what happens in the academic centers. And so they have a lot of practical insight and input on what works and what doesn't work, and then how to make it fiscally sound at the same time.
Yeah, absolutely. Because many times the private practice folks have much more volume than the academic centers, and they very quickly find pain points, quite literally, in where we may struggle as a group maybe growing a certain type of a practice. And that brings me to one of the other innovations for this meeting is that, and shout out to Kevin Vorenkamp for letting me do this, is that we used to have a practice management track on Saturdays, kind of like the tracks that we have here, but it was nothing but practice management. And I feel so strongly that that practice management needs to be integrated into everything that we do. We need to understand the regulations that surround everything we try to do as pain physicians, all the social and economic burdens that are a part of what we're doing, especially in chronic pain. So now in each of these tracks, embedded in those is smaller sessions on practice management. So for example, our first head and neck refresher course, we go from basic science research with Tina Doshi talking about biomarkers, whether a lab test can diagnose types of facial pain, to neuromodulation for headache syndromes, and several more. And finally, practice management for high volume niche clinics. So I think there's something for everyone built within each refresher course that you can go from, I'm learning all the science I need to learn, all the implementation I need to learn as well.
One of the things we saw at the last fall meeting was that the practice management courses, those sessions were packed. I mean, people spilling out the doors with so much interest in that. And I think that you were wise to incorporate it throughout the meeting because the interest level is high, particularly in chronic pain physicians. I'm an acute pain physician, regional anesthetic focus. And honestly, practice management is not as big a part of my day-to-day concerns. Usually I'm twice or three times removed from those concerns, particularly in academics. But what we saw in the fall meeting with chronic pain physicians, both academic and private practice, is that is a big part of the thought process that goes into how do you run a clinic, how do you take care of these patients, and there's tremendous interest. One thing I want to point out is that on the program, and it won't look exactly like this when you get it at the meeting itself, but you can see this online, is these little logos on the right, these little icons on the right-hand side. These are actually representing the special interest groups in ASRA pain medicine, and they are sort of sponsoring or focused or present the focus of that talk within that special interest group. So you may have a speaker from that special interest group, or the topics were brought up from that special interest group or relate to those people. And so if you're looking for how to navigate the schedule or hop through these tracks, another way to do it is to follow these icons based on what your interests are. So HA stands for headache, NPPA stands for our nurse practitioner and physician assistant, special interest group, private practice are for practice management type topics that may be related there. And then this goes on, and you'll see throughout the program that a lot of these are relevant in different places. So it's another way to find these topics, but I really commend you for incorporating the practice management. I think all of us need to be wise about that.
For sure. And I just want to shout out to all of the SIGs. It's no error that these tracks all kind of follow along our SIGs, like peripheral nerve and joint. That includes regenerative medicine, includes peripheral nerve stimulation, a lot of ultrasound too. So they have been really fantastic in offering ideas for faculty and ideas for content too. And they always represent, I always say, our SIG folks at the meeting, and really engaging too. So say hi to them when you're there.
You mentioned practice management in the sense of health inequities. You kind of hinted at that, and that's one of your interests as well in the program. Where do you think that's, how does that apply to pain management in your opinion, and where does that fit into your program?
Yes. Well, honestly, I try to phrase it as untapped opportunities, because I think sometimes we get a lot of pressure to think of, diversity as a chore or a burden. Sometimes people tend to think of having to deal with socioeconomic factors as something difficult, but really I think there are opportunities for us, and there are so many folks. My area of research is in databases looking at rural access to care, but the same thing happens in urban and underserved areas where do you like doing stimulators? Well, you can do a whole lot if you can figure out how to get your skills to these folks, and their lives are going to be better. I mean, what is more rewarding than that? And I really wish that we could kind of see the opportunity in encouraging diversity as well. Not to mention, we have Dr. Doshi talking about diversity in the workforce as well. And if we don't think about that now, if we don't preemptively hire and work to attract folks from all different backgrounds, we're going to be behind the 8 ball. And for a thriving practice, we really need to be ahead of the times by several years.
Yeah, that's an interesting point of view, is that, you're right, that I think that oftentimes topics of DEI are resisted by people because of it's perceived as a burden. But actually the point of view that, from a purely selfish point of view, it's an opportunity of both a patient base, a practice base, and and obviously at the same time you're delivering care to a population that is underserved in a lot of ways. And we often don't think about it that way. I don't think that's brought up in conversation very often.
Yes, absolutely. And I finally found the parallel session that covers that too. And it's specifically for neuromodulation too, because there's so much research on opioids and other types of access to care. And a lot of the diversity work is done outside of interventional pain. So I am hoping that this kind of helps bring to the forefront what we can offer as interventional pain physicians, and that the work, the the work of this is also on us. So we have Tina Doshi talking about attracting underrepresented physicians. I'll be talking about patient access to board-certified interventional pain physicians, which is much harder than we all think.
Yeah.
We have more on social and economic barriers and racism in medicine.
No, that's a great session, and I think a lot broader thinking than what we normally do on this topic of underserved populations, and particularly when you focus on rural populations too. I think the opioid crisis has clearly hit rural populations as much as, if not more, than urban populations, and their need for good options for pain management that aren't just giving more opioids is essential and leads to a lot of harm that's happened in these communities beyond just pain control. So delivering access to those environments is critical.
Yeah, absolutely. And in other places too, we talk about ways of delivering care too, like telemedicine. And, part of the Making Connections theme is that we have a global theme. We have several faculty from all over the world. We have Ji-Yoon Moon coming from Korea to tell us about the Korean experience. And I think so much of that we can learn from to really bring different ideas and innovations towards getting care out to people who live, on a mountain in Colorado, or people who live in a really underserved area of Chicago.
One of the topics that always comes up in pain management is cannabis. And, ASRA Pain Medicine is about to publish in regional anesthesia pain medicine a new cannabis, I don't know if it's a guideline, but practice advisory about how to handle patients coming in for other procedures who are on cannabinoids chronically, and then what's the management strategy with that. Obviously, this is a part of your topic as well. What I want to kind of ask you about is one of the news items that has come out through the pandemic is the opioid epidemic hasn't gone away. In fact, probably has gotten worse. And in parallel to that, the conversations about expanding cannabinoid use for pain management has come up as sort of a parallel conversation. Where do you see the intersection of that, and how do you think that's going to be approached at this meeting?
Yeah, that's a great question, and I love that you brought up the parallel session already, because honestly, I don't know what I think about this because it is so fraught. There's so many factors that go into it, more so than just a medication like gabapentin or Tylenol. Part of it is that cannabis is still a Schedule I medication, and what does that mean for research? How do we do true placebo-controlled trials? How do we compare it to other medications that we have? There's so much state law that goes into it where that's not a factor anywhere else. So speaking of special faculty, one of ours is Kate Nicholson. She is on Twitter, and you all should follow her. You should watch her TED Talk. She is a lawyer who works with chronic pain advocacy as it relates to opioids, medication, disability rights. And she's also a pain patient herself, and really has some thoughtful and interesting things to add to the conversation that from a voice we don't always hear from.
Fantastic. So we've got our third guest here. He was having some technical issues. Alexios, how are you? And I'm going to try to say your last name, Karyanopoulos. I practiced earlier. Did I get it pretty close? Yeah. Karyanopoulos. Welcome.
Good. Thank you.
Nice to meet you. And I don't think we've actually met in person, but it's very nice to meet you. I'm going to do your brief bio intro, if you don't mind, just so people know who you are. Dr. Karyanopoulos is the chief of the departments of physical medicine and rehabilitation at Rhode Island Hospital and Newport Hospital, and is the chief of the division of physical medicine and rehabilitation of Lifespan Physician Group. He's also a physician at the Norman Price Spine Institute and is a clinical associate professor of neurosurgery at the Warren Alpert Medical School of Brown University. And I'm sure there's much more that I could tell people about you, but that's just a brief snapshot. Welcome, Alexios. How are you?
I'm good, thank you. I'm sorry about the delay and the technical difficulties, but I'm here and I'm happy to be here.
No, I'm so glad you made it. I know that these online things can sometimes be fraught with technical issues. So, Alexios, I'll bring you into this conversation. So, for those of you who don't know, you're chairing next year's meeting, correct?
That's correct.
Yeah, so you're going to be learning from Amy's experience during this meeting and figuring out how to fine tune and top her in her experience and make one meeting better than hers, I'm sure.
Well, I think we're working together as a team. Amy, myself, and Christy Hunt, who's the 2024 chair, and I think we've made a really nice team in terms of looking forward with ASRA and trying to add in elements that would really enrich the community, enrich our membership, and advance the specialty.
Yeah, and one thing I want to mention is you're PM&R trained, right? And
That's
so,
right.
I think you're going to be the first chair that's PM&R physician as chair of this meeting. And that was a conscientious choice as we've explored the expanding roles involved in pain medicine. And so, I want to make sure that people understand that the society is looking towards these larger groups of people because every one of them has a component of the conversation about how pain medicine is delivered.
Right. I couldn't agree more. And ASRA has never been more welcoming than they are now. I joined the society out of fellowship. David Provenzano and I actually were in fellowship together, overlapped, and he was the one that encouraged me, wanting me to bring in my expertise and understanding how it complemented what the traditional anesthesia folk do. And as you all know, we're a much broader specialty than we were 10 or 15 years ago, with neurologists, psychiatrists, radiologists, physiatrists, and of course anesthesia, and among others. And I think we really learn from each other, and it's really important not only that we share our clinical skill set, but also our physical examination skills and our life experiences in different settings throughout the academic and the private practice world.
Yeah. So, speaking to the fact of the different people involved in pain management these days, one thing that has been present at these fall meetings is the presence of nurse practitioners and PAs. And their contribution to pain management. Amy, I'll start with you. You want to talk a little bit about how that fits into the program, and I can try to pull it up on the screen here as well.
Yes, we have a whole session, a whole track really on Saturday for the PA and NP program. And the great thing, especially about the ASRA PA and NP programs, is that it is pretty much self-designed by the PA and NP group. I received a really well thought out and detailed list of requests from them and ideas that they had. Their is it PA01? All of their faculty and I think that makes it really tailored towards what our APPs really want to learn and be involved with. And it's nice that it's on a Saturday too. So if somebody wants to just fly down, learn on a Saturday and head on back, you get 6.25 credits for the morning.
And if they want to stay for the whole thing,
Absolutely.
like their sessions don't conflict with many of the other sessions at the meeting. And so I know one of the things that I've spoken to some of the members of that special interest group was they felt like they were so separated at times they couldn't participate in some of the excellent talks that were given on the first and second day. And so you guys have created an opportunity where they can do both, right? They can have a focused program that meets their needs in their specific roles, but also they get to participate in the science that's being presented for the pain specialty as a whole.
Yes, absolutely. And I keep thinking back to like the tracks and, like peripheral nerve and joint, for example, if someone's trying to grow their regenerative medicine practice, you need a whole team to do that. So, why not go down, like a physician, nurse practitioner or PA pair, go on down and learn, and like everybody takes in different information. So I feel like that's really complementary to when a practice is really wishing to grow a certain part of their niche, either, head and neck interventions, regenerative medicine, doing some more, spinal cord stimulation for, more unique reasons. All of that can can be covered here.
Alexius, I want you to talk a little bit about the workshops. I know that's the hands-on experience is a big reason why people come to the meetings. You can't get that on a Zoom call. You can't get that on a webinar. Talk to me a little bit about anything that you think will jump out to people about the workshops and stuff they should pay attention to. And then Amy, I'll let you chime in on that as well.
So that's a great question. I think the most important thing is that ASRA has really taken the feedback of attendees of prior meetings seriously, and we've reflected upon what they like, what they don't like, how we can improve, and we really value the opinions of our membership. Essentially, what we're trying to do is tailor the workshops to the hands-on opportunities that you really need for the practical, everyday practice of pain medicine. So it's terrific to be in an environment where you're hearing lectures and networking, listening to people. But for the everyday pain clinician, or even somebody who's has their hands in academia and administration and clinical medicine, having that hands-on is invaluable. And being alongside your peers and hearing from experts who are mentoring you or guiding or just sharing their opinion, I think is key. We really try to make the workshops very comprehensive. It spans from everything, including sort of the classic bread and butter type procedures, all the way through advanced procedures. We recognize the fact that people are in different levels of their experience and training, and we try to be very sensitive to that. And we value the interaction that occurs during these workshops in either the didactic portion of the workshop or the clinical hands-on. And we're really trying hard to collaborate with our industry partners. And I think it's really important to acknowledge the support that we get in terms of unrestricted grants and things like that, where we're offering the opportunity to learn about technology in an unbiased way. And we're presenting these opportunities without focusing on a specific technology or specific company.
Amy, you want to add anything to that? Oh, I think you're muted.
Can you hear me now?
Yeah.
I would just like to put in a plug for Dr. Karyanopoulos' meeting too, because he really took the workshops to the next level, and he also really focused in on making it a much more valuable meeting, not just for the APPs, but also for the residents and fellows too. So like he's definitely like building upon what I have. And even though on Saturday we will have, of course, resident and fellow workshops, I'm really excited for next year too.
Yeah, that's just a teaser. Pay attention to next year's program as it comes out. This is an evolving process. So I just kind of scrolled through some of these. I mean, it's hard to read on the small screen, but go to the website and you can see the details. And this is one thing that I want to remind people is that these things sell out. So when you're going to register, like, go sign up for your workshops because they sell out fast. These are really popular workshops and they have small numbers. So it's important to register early and get all the ones that you want early on.
Raj, if I may comment on that. Sorry to interrupt, Amy, but that's intentional. We don't want to have an overbearing crowd where nobody gets an opportunity to have the hands-on or to raise their hand. And again, we are reflecting on previous year's attendance records, previous year's input regarding how they were satisfied or not, and tweaking things as we go. So these are very limited offerings, and I think they're going to be great opportunities to learn.
Yeah, so I was just going to add that some of our workshops and PBLDs are already selling out. And I think what's happening is that, this is Disney, and it is going to be a little bit of a fun trip for a lot of people. So I think a lot of folks are, they're calling their friends from fellowship or from training or, from anywhere else. They're all meeting up in Florida, and they're taking the workshops and PBLDs together. So that's
fun.
one way to do it too, is to join together with a group and sign up for the workshops. But if you want to do that, I would do
it's like reliving fellowship for some people. They get to train with their buddies again. That's awesome. I would be remiss if I didn't mention, it is making connections was the theme. So I would be remiss if I didn't mention the social activities that are available. There's a variety of, and traditionally we think about them as just, have some drinks, a little party, talk to some people, but there's actually some very focused programming in the social. Can you guys hear me? I think I lost my connection there for a second.
You're back.
Yeah. Okay. Sorry about that. So I said that there's some really focused events that I think people should pay attention to. There is an opportunity to connect up with mentors, and I think that's really important. Amy, you want to talk about that briefly?
Yes, and this is part of the whole tracks thing again, that people, and someone can be a mentor for you, but you can be a mentor for that same person in another facet of what you do. So open your mind as to who's a mentor and to the fact that you may be a mentor for a lot of people as well. But yes, this is a huge thing with ASRA, and I think it's a big reason why I stayed in it and why I joined it in the first place. ASRA is also where all of the PAIN program directors meet for all the programs across the country. So this is the place to be for residents and fellows, and even medical students who are interested in pain. This is a place to meet the people that you need to meet. I don't know, I think that can really help open up opportunities. So we've got a welcome reception and exhibit hall opening. One thing I really want to point out is the diversity and inclusion networking dinner. It is hosted by women in regional anesthesia and pain medicine, which I'm the vice chair of. But it is open to literally everybody. It's going to be kind of an intimate setting. We'll have 5 different tables where you can talk about different topics that you want to and learn from some awesome experts. And as Raj said, some of us are early morning people. I am not, but if you want to do the fun run and walk, it's at 6:15. I actually might.
If you feel motivated,
yes.
If the time zone shift is not bothersome to you.
Burn off what you ate at the reception.
Right, exactly.
And then, meet and greets for residents with the program directors, for the PAs and NPs, nurses, new member meet and greet too. We love new members. And we have so many faculty that are not anesthesiologists in our program that I think you are going to be able to meet all sorts of different people that you would not have met otherwise. There's emergency medicine faculty, there's spine surgeons, psychiatrists, psychologists, there's a lawyer, all sorts of people, obviously folks from industry. PM&R is already us.
Yeah. But I mean, going back to your mentorship, mentorship often people do struggle to find mentors when they don't see somebody who's in the same discipline as them, or they feel like it's harder to connect with those people. And having opportunities to meet mentors that either practice like you do, private practice or academics, or comes from the same training style or training discipline as you, or even who maybe look like you, have gone through the same challenges that you've gone through your career. All of those are opportunities to connect with people and make mentor relationships. Alexios, with these social events, I mean, we were talking earlier, Amy and I were talking about missing these in-person meetings. Your thoughts on, all these meets and greets, that opportunities.
I just wish there was more time to attend all of them. And I think just to pick up on the mentor-mentorship relationship, I think the learning happens on both sides. I look at this opportunity I have a mentee rather, and I think it's a great opportunity not only to learn in different environments, but for fellowship and in terms of having a bite to eat or being able to interact with other people and network together. I think that in itself is a very powerful relationship that can be strengthened with these opportunities. I think it's also really important that we get to know each other a little bit more, and sometimes it's harder to do that in a formal didactic setting, and we're all running around and we're very busy. And I think this is a great time to talk, listen, get to know your colleagues in a collaborative, happy environment like the meeting, and of course at Disney.
And then, of course, on Saturday, we have the Excellence in ASRA Pain Medicine Awards Luncheon. You do need to buy tickets. They're $10 if you're a member, and that includes lunch. So it's not very expensive to attend. It's a great way to kind of be part of the community of the society, but then also listen to a fantastic talk. The speakers are always amazing. The award recipient this year is Dr. Jose De Andres, and I'm sure that that presentation will be excellent. And then Saturday night we have the annual celebration at the end. That's where Amy gets to finally relax, and Alexia's stress level goes up because then he has to assume the torch. I think there's a torch passing, isn't there? We should have a torch passing or something. And that's always a great, fun way to kind of be part of this community at the end of this wonderful meeting.
Yeah, so I've been going to ASRA for probably 8 years now, and I started going as a resident or fellow, and I had no idea how fun the annual meeting celebrations were, and like that so many people went to it and just had so much fun that eventually, I had to go every year, and they have not disappointed. Heidi Border does a great job picking venues and entertainment, and the attendees definitely bring the fun. So
yeah, I have to say the fall meeting, you guys are always theme oriented more than we are at the spring meeting, and this one's the Hawaiian theme. So the more into it you are, I'm sure the more fun you'll have. I expect full costume, Amy.
Don't think I won't. I do have a tiki dress.
Well, we could go on and on about this meeting. You guys have a fantastic program. There's no doubt that it's going to be a phenomenal meeting. There's more abstracts accepted for this meeting and submitted for this meeting than ever before for a fall meeting. I think it's over 400, abstracts for this meeting. And that just tells you what the interest level is and how much excitement there is about participating in the in-person meeting for a society that's so cohesive and inclusive and growing. And I think that you'll see that when you attend. Mm-hmm. Alexios, any parting word before we finish up today, and other than encouraging people to register?
Well, just to back up a little bit, I was really pleased by having had the opportunity to review these abstracts. The level of intellectual curiosity and clinical experience and innovative spirit in these abstracts was very impressive, and I think we really have the best of the best. And it'll be reflected in some of the best abstract awards, which will be forthcoming. I thank Amy for all the hard work that she's done for the society and for this meeting, and she's really paved the way for myself and for Christy. And it's all about improving ASRA and making it even a better society for all of us, not just the ones that are currently involved. We do want other people to get involved. We encourage trainees, residents, and fellows, and people at all levels of experience to come in and share their thoughts and to participate.
Amy, last thoughts?
Yeah, our previous record for abstracts was low 400s, and we hit 485 for submissions.
Oh, wow.
We're going to have, we blew it away. So
wow.
That means we're going to have some really fascinating people attending the meeting too, and bringing, their groups along with them. So I'm excited for just the volume of people that we'll see. And I think it's going to be amazing, and I look forward to seeing everybody there.
I'll be there, and I actually have 2 abstracts that got accepted, but in the humanities category, so it's my photography that was actually accepted. So I'm curious to see what other people have submitted in that category, and hopefully, broaden that conversation about what it means to both be a physician in this specialty, but also thinking about humanities from a patient care point of view as well, which is really important in pain management.
Absolutely.
So last reminder, the meeting is coming up November 17th through the 19th in Orlando. The early bird registration deadline is next week, October 6th, so don't miss that. Register for your hotel, register for those workshops because those things go fast. We already told you how many people are coming. So make sure you get in early. Otherwise, you might miss out on that really thing that you want to do. Not to mention that there's going to be tremendous other stuff that you don't even have to register for separately. So there's going to be a lot there at that meeting.
Yes, the hotel blocks are discounted as well, and they go very fast. So sign on up.
All right. Thank you, guys. I'm looking forward to seeing you in person. It's just a few months away, and I can't wait.
Thank you.
Thanks
Can't
for
wait to see you.
including us. Take care.
Bye, guys.
Right. Thank you.
Bye.
Bye-bye.